So, before we hear from our guests, I wanted to hand over to Your Royal Highness to say a couple of words.
Thank you, Ed, and thank you everyone for being here today and from overseas as well. But I wanted to just say a personal thank you and welcome to you, Dr. Biden. It's a huge honour to welcome you here in the United Kingdom, and I hope you'll enjoy the discussion today, and thank you for your interest in this work. So very much looking forward to today's conversation. Thank you.
Thanks. And I want to say thank you for everybody for this program today. Thank you to the Academy. I met some wonderful teachers and principals and most of all the children who were so inspiring and so well behaved. I know I couldn't get over it. But and I want to thank the press too for covering this, because early childhood education is so important to lay the foundation for all of our students. So thank you for having me and for inviting me here. It's a very special place, I can see that.
I'll mention a survey that has been conducted during the last 15 months, the period of the pandemic in the United States, a weekly survey of families with young children. And what we've seen there is that, and the findings have showed us that, that the pandemic has taken a tremendous toll on caregiving, in particular material hardship.
You have both quite a busy day, and I'm under strict instruction, so I feel like we could carry on talking about this for a long time, and it's been a really lovely discussion, but I'm afraid we're going to need to close in a few moments.
I have a million questions written down.
Well, I tell you what,
I have to give you a call.
You're most welcome to come to Felton, but we'd love to hear any closing remarks you have, any closing reflections.
Oh my gosh. Well, I'm sorry it's so short. That's my first comment. Because there's so much we need to talk about and to dialogue about, and so I just don't know where to begin. But as an educator myself, so much of what you're saying has certainly touched my life, in that I taught in a psychiatric hospital for 5 years, and so I see, I've seen the, what the children's environment and what. That, if it's negative, the effects that has, and I saw that with all the children that I saw in that psychiatric hospital and the problems that they were dealing with, and I have to say, I love that you're educating dads and fathers, because it's, it's been so long that for the longest time it was always the mother, right, who was doing the caregiving. But I think one of the positive parts of this pandemic is that now we've seen both the parents, because they've both been home, and the fathers are saying, hey, this is hard work, and they've pitched in. Yeah. And I know things are changing from, when our kids were little, but I think that the pandemic has also had a positive effect in that I think teachers are now working more closely with parents, because that relationship had to open up, right? Because there were so many areas where teachers were helping parents and parents were helping teachers. And so it's just such a fascinating discussion, but I think we're moving in the right direction. And I also wanted to ask about food security. I had so many things that I wanted to ask about, but I guess I'll have to just come back.
Definitely will. Your Royal Highness, any closing reflections?
Well, I'm the same. I could talk about this for a very long time, and it's so lovely to see so many familiar faces. But just to pick on, I suppose, what's been discussed a bit about the importance of parenthood, and a bit about, I suppose, my own journey into looking into the importance of early childhood development, and just touching back on the conversations around supporting parents. I'm really interested about how could we best prepare the next generation to become parents themselves. So actually the focus isn't sort of on parenting itself, but actually how can we give them the tools so that they're having their babies and raising their children with these greater tools. And I think that's something that education all the way through the system, I think, would be really really powerful. But in terms of my own journey, yes, it's been about prevention, and I've really started looking into this work to see what we could do to help prevent some of today's tougher social challenges, whether that's addiction, poor mental health, violence and things like that in the home. And I suppose I've heard time and time again from the likes of Eamon, from parents, from practitioners. I like just how important the first 5 years of life are for future life outcomes. And I suppose in listening to everybody, I suppose that's why this was, for me, really important. That was, to have this place where we can all come together, whether it's parents or neuroscientists or academics, or those working with parents themselves, but just to really raise the importance of the first 5 years, because I really do feel the best investment for our future health and happiness lies in the first 5 years of life. But Ed, to your point, only by working, and I think Eamon, you referenced it too, only by working together in a holistic way are we going to be able to achieve that. It is the healthcare, it is the education system, it is working to translate the science for the parents, to make it accessible and usable, and making sure parents' mental health is best supported and all those around children, and raising the next generation today. But ultimately, my hope is that we change the way we think about early childhood, really for generations to come. And I'm committed to this for the long term. And I hope our two countries can keep sharing data, knowledge, and best practice for many years to come. But thank you for your interest today.
I'm sure we will. Thank you. Thank you for your interest.
Well, look, thank you so much. And I have to say, on a personal level, about 4 years ago, we sat down at my school and we had a conversation about thinking about our pupils as the parents of tomorrow. And that was really transformative for us. So what you just said really resonates. A huge thank you for your time. Thank you so much to colleagues. We hope that one day we might meet you in person. It feels like a long way off. And thank you so much, Dr. Biden, for joining us.
Thank you.